Thank you for choosing Grant Medical Center for your orthopedic care. My name is Sam. I'm a nurse practitioner specializing in orthopedic surgery. You may see me at some point after your surgery. In today's online class, we will be preparing you for your joint replacement surgery. This is our class agenda. We're going to be discussing what a joint replacement is and what it means to you before, during, after surgery. So hip or knee arthroplasty is just the medical term used to describe your joint replacement. You may see this term on your surgical consent or even in my chart. Surgeons will use implants to resurface the damaged bone and cartilage that you have either in your knee or your hip. Many of you may have gone through conservative treatments such as joint injections, braces, PT, and now you're to a point where you've failed all those conservative measures. Typically, surgery is reserved for patients with severe arthritis. So the total knee components consist of the thigh bone component that goes on your femur. There's also a shin bone tray that goes on your tibia, and a little plastic piece that goes in between that basically acts like the cartilage that you no longer have in your knee. Partial knee replacements are for patients that just have significant arthritis on one side of the knee. These implants mimic the total knee replacement components and are just limited to the affected side. So again, you have the thigh bone component on your femur, the shin bone tray that goes on your tibia, and then the little plastic bearing that goes in between, again, acting like the cartilage in your knee. Total hip components consist of the cup that fits into your pelvis, a little plastic piece that goes in between, and then the femoral component, which consists of the femoral head and the femoral stem that fits down into your femur. Elective surgeries such as this require medical clearance. When you're scheduled for surgery, your pre-admission testing appointment is set up. This appointment is required to be completed within 30 days of surgery. This appointment makes sure you're medically optimized and that you're safe to undergo anesthesia. Typically, this is performed by the general medicine consultants, or we call them Gen Med, or it could be performed by your PCP. During your pre-admission testing, they will do an extensive history and physical. A lot of times they take urine samples, blood work, they may do a chest x-ray or an EKG. Sometimes it requires specialized clearance, such as cardiac, pulmonary, or neuro. At your appointment, they will let you know if you need any type of specialized clearance. Any incomplete testing can cause delays or even cancellations day of surgery, so it's very important that you go to this medical clearance appointment. At this appointment, you need to talk with your doctor about what medications you should take before surgery. There are certain medications such as heart meds, blood pressure meds, diabetes medications, over-the-counter medications, certain weight loss medications, and blood thinning medications that need stopped prior to surgery. They will let you know at your appointment what meds you should continue and what meds you should stop. Make sure you're only taking the medications you're directed to morning of surgery. Maybe set a reminder in your phone. That way, if there's a certain date you need to stop the medications, you do so. And just as a side note, if you're running low on any of your normal medications, please call your PCP ahead of time, as we can't refill your medications after surgery. You want to make sure you increase your hydration prior to surgery to ensure you're well hydrated. Drinking plenty of water, at least a week prior to surgery. And then also in your guide, your patient guide that you get in the office, you can actually start practicing your ankle and quad exercises prior to surgery. Anesthesia guidelines for when to stop eating and drinking foods. Stop eating foods 8 hours before the time you're scheduled to arrive at the hospital. This includes obviously food, but also candy, mint, gum, and tobacco. We do allow patients to drink clear liquids 2 hours before coming to the hospital. So if you're scheduled at 8 o'clock to come into the hospital, you can drink clear liquids up until 6. And this obviously includes water, but also includes drinks like Gatorade, Powerade, black coffee, and plain tea. We ask that you do not put any cream in your coffee or drink any protein shakes, as this could delay your surgery. If you smoke, we encourage you to quit smoking at least a couple weeks before surgery. Smoking can obviously cause breathing problems after surgery, and it increases your risk of medical complications following anesthesia. And believe it or not, it actually slows wound healing. It's a big risk for infection. Smoking decreases blood flow to your incision for several hours after surgery, and that can lead to infection. So we always encourage patients to quit smoking prior to surgery. It's important for you to be honest with your healthcare provider about any alcohol use you do, letting us know how many drinks per day, per week. It just helps us determine if you're at risk for any alcohol withdrawal after surgery. And this also includes if you take medications that aren't prescribed to you. My best example is if you take narcotics that aren't prescribed to you. We just want to make sure that you're safe post-op and there's no complications. So just be truthful and honest with your healthcare provider. As far as what to bring for surgery, we want to make sure you bring, obviously, your insurance cards. If you have a copayment, you'll need to bring that, photo ID. If you have an advance directive or living will you'd like us to have on file, feel free to bring that in. And again, bring a list of your medications, especially if anything has changed between pre-admission testing and surgery. You want to wear a good pair of walking shoes in, comfortable, loose-fitting clothes to wear in the hospital and for going home. We ask that you don't bring any of your home meds with you. This is just a safety issue. We don't want you taking your home medications and then the nurses are giving you medications. There can be some errors and duplicates. So just leave all your home medications at home. You are able to bring in your CPAP or BiPAP machine if you stay the night. Try and leave all your valuables at home, especially jewelry. Just bring only what you need. As far as your arrival time, Grant Hospital will call you the day before to let you know what time to arrive. Typically, this call will be after 10 o'clock when our surgery schedules are finalized. At that time, if you have any changes in your health history, such as you develop a rash, you have a cold, you have an infection somewhere, make sure you let them know. Your surgery could be postponed or even canceled day of surgery if you have an active infection or if you're ill. The night before surgery, please try and relax and get a good night's sleep. We ask patients to bathe the night before surgery and also the morning of with just some mild antibacterial soap, such as Dial. You can brush your teeth. If you have any medications that you have to take morning of surgery, make sure it's just with clear liquids. You can wear your dentures, glasses, hearing aids, and that's fine. We offer free valet parking at Grant, so feel free to use that when coming to surgery. After you valet park, you're going to check in at the front desk, and a guest service liaison will direct you to the second floor waiting room. Pre-op will come get you and take you back to the pre-op area where they'll complete your bedside registration and get you ready for surgery. Please note, family or your support person will remain in the waiting room until after you've changed. This is a picture of what our pre-op bays look like. This is where you will sign your consent for surgery if you already haven't. A nurse will review your health history, including allergies, medications. If you need any additional testing, they'll do that in the pre-op bay, such as lab work, EKG, blood sugar taken. And then they'll also give you an IV and give you fluids while you're in pre-op. In pre-op, there will be a surgical site prep performed if needed. And then you'll also be given special cleansing wipes to clean your body before surgery. These wipes help remove harmful bacteria that could potentially cause infections after surgery. The nurse will also apply nose and nasal sanitizer. Think of this as a long-acting hand sanitizer for your nose. The nurse will apply the nasal sanitizer on both sides of your nose. 80% of MRSA infections actually can be traced to a patient's nose, so this helps decrease that potential. Also in the pre-op bay, your anesthesiologist will talk to you about your anesthesia options. Typically, surgeries are performed under general anesthesia. That's where the anesthesiologist gives you medications through your IV. They insert a breathing tube and you're asleep throughout surgery. That's called general anesthesia. Something that they may offer to you in addition to that, for our total hip patients, you may be offered what's called a spinal. And basically, it's like going to the dentist and getting your tooth numbed. They insert a tiny little needle in your back, and it helps numb up your legs after surgery. So it helps with post-op pain control. Typically, this usually lasts about 2 to 4 hours. And then also for our total knee patients, something that they may offer, it's called a regional block. Again, they use ultrasound-guided, a small little needle that goes into your knee, and it helps with post-op pain, helps block out that pain impulse in your knee after surgery. The surgeon will also see you while you're in the pre-op bay, answer any last-minute questions, and then they will initial your surgical site. When the nurse is ready, the nurse will come out and get you, take you back to the OR. Just be aware it's very cold back there, and the surgeons and staff will wear, they almost look like spacesuits in the operating rooms. It's obviously to keep bacteria out. It's not unusual for there to be several people back in the OR. Everybody has their own specific job. After they get you to the OR, they'll get you to the OR table, they'll connect you to a heart monitor, have you start breathing oxygen, they'll get you warm blankets, and then they will proceed with your anesthesia. Surgery normally takes, about an hour or so, sometimes a little bit longer. After surgery, you're going to wake up in the recovery room where our nurse will be observing you closely. You more than likely will wake up with some nasal cannula in your nose, and it helps supply supplemental oxygen. The PACU nurse will also be monitoring your pain and giving you medication as needed. The surgeon will also call and meet with your family to discuss how the surgery went. Your health history and surgeon preference will determine if you're able to discharge home same day. Typically, this is determined in the office prior to surgery, and you'll be in the recovery room until you meet certain criteria, such as you're medically stable, able to walk with therapy or nursing, and your pain under control. Patients that are planning to stay the night, you'll be in the recovery room until you're transferred to your inpatient private room. Typically, one family member or support person will be able to visit you when you're in the PACU. In the PACU, you may wake up with, if you're a total knee patient, you may wake up with either a post-op drain or a knee brace. For our total hip patients, you'll wake up with a hip abduction pillow, and this prevents you from doing certain movements right out of anesthesia to prevent hurting your new hip. You'll also wake up with a bag of ice, either on your knee or your hip, and you may have a little bit of a sore throat after surgery. Let the nursing staff know if it's too sore and we can get you some throat lozenges. As far as your surgical bandage, we use a couple different type of dressings after surgery. The first bandage that I'm going to talk about is an Aquacel dressing. This dressing is waterproof, so we allow patients to shower over top of it. It's antimicrobial. It has silver impregnated in it, so it's nice because these dressings can stay on about 7 days. It's not unusual to have a small amount of clear bloody drainage from your wound after surgery. Typically, this will show up as some dark shadowing on the dressing. You'll want to notify the office immediately if you start saturating dressings after discharge. Another dressing that we utilize after surgery is called a Pico dressing, and it's basically like a portable, disposable wound vac. It's battery operated. It's, again, waterproof, so you can shower over top of it, but the battery pack is not waterproof. So we always suggest either undoing it or keeping it outside the shower so it doesn't get any moisture on it. These dressings are nice because they can stay on for 14 days. And again, it's like a little mini wound vac. It sucks on the wound and it prevents any drainage from sitting on your incision, and it actually speeds up the healing process. Just be aware our night shift nurses take vital signs frequently throughout the night. Blood draws are also done pretty early each morning, so you won't get the best rest. Most of our physicians will do rounds in the morning, and this typically includes the bedside nurse, an orthopharmacist, and an advanced practice provider, such as a PA or a nurse practitioner. Physical therapy and occupational therapy will see you until you meet your goals. We'll discuss that a little bit later in class. The nurses give report at 7 and 7, and they do bedside reporting. All of our rooms have a nice little whiteboard that's a good communication tool between you and your healthcare team. The nurses will write down what pain medication you're getting, when you had it last, and when you can get it again. That way you can ask for it. After surgery, you'll be started on a clear liquid diet, and then they will advance you to a regular diet as tolerated. You want to make sure you let your nurse know if you feel super nauseated or if your abdomen feels full or distended. A potential post-op complication is developing a post-op ileus, and it's kind of like when your belly kind of goes to sleep. So make sure you let your nurse know. That way we could order special medications to help kind of wake your bowels up. Something that can potentially arise after a major orthopedic surgery is developing pneumonia. After surgery, your lungs kind of go to sleep, so you have to wake them back up after surgery. So coughing and deep breathing is very important, and then also using your incentive spirometer at your bedside. We normally ask patients to do this about 10 times an hour, so I typically tell patients if you do it 2 to 3 times every time you're watching TV during a commercial, you should get your 10 an hour. Get out of bed, obviously, and walking with help, and then changing positions when you're in bed. After a lower extremity orthopedic surgery such as this, patients are at risk for developing a rare but serious complication called a DVT, or a blood clot. The surgeons will do several different things to prevent you from getting blood clots after surgery. Wearing elastic stockings, those TED hose, typically we have patients wear them on both legs for about 2 weeks after surgery. Also, while you're in bed at the hospital, we'll have compression boots or pumps while you're in bed, either on around your calves or on your feet. And then you'll also be started a blood thinning medication to prevent blood clots. The next presenter is a pharmacist who specializes in the surgical setting. She will be discussing medications that your surgeon will be prescribing and the importance of them.
Hi, I'm Sarah. I'm a clinical pharmacist at the Bone and Joint Center at Grant Medical Center. I or one of my teammates will be involved with your care throughout your surgical stay with us, where we will be helping the doctors and the healthcare team manage your medications to help ensure you get the best possible outcomes after your surgery with the least possible amount of complication or side effects. As mentioned, a blood clot is a rare but life-threatening complication. So I wanted to take this time to talk about this and some of the other medications you'll be exposed to during your hospital stay. To prevent blood clots, in addition to those compression stockings and the foot pumps discussed, we will be prescribing a low-dose blood-thinning type of medication to protect you from blood clots, and this will be given to you during your hospital stay and after discharge. These will usually be in the form of tablets to be taken, generally one in the morning and one at night, during your hospitalization, starting either the night of surgery or the morning after. These will also be prescribed to you at discharge, and you will need to take them generally for about a month after your surgery. This is because our blood naturally thickens in response to the surgical process, and so everybody needs some type of low-dose blood-thinning medicine to help prevent our blood from clotting too much. It's very important to take these medications as prescribed, because it takes several weeks for your body's blood to kind of get back to normal and for you to not be at this increased risk of having blood clots after surgery. In terms of side effects, these medications are usually very well tolerated, but certainly you will be at a slightly increased risk for having bleeding or bruising. So we would like you to monitor your surgical site and definitely call your surgeon with any concerns related to significant or unusual bleeding or bruising. In addition to the blood-thinning types of medication, we will be giving you medication to help manage the pain after surgery. Now, the first step in having a successfully managed pain after surgery is recognizing that it is normal and natural to have some degree of pain immediately after a major surgery like this. We say this not because we will be inattentive to your pain by any means, but we want to make you as comfortable as possible while ensuring your safety throughout your surgical stay as you get exposed to anesthesia and various pain medications. To make you completely pain-free after a surgery like this wouldn't be a reasonable expectation, because that would mean that we would have to give you so much of the anesthesia and pain types of medicines that you could have unacceptable side effects. And we'll talk about some of those. So we will be managing your pain and making you as comfortable as we possibly can. But the most important thing is to keep you safe and to help you recover and mobilize with physical therapy early and often after your surgery. To accomplish this, we use what is called a multimodal pain management approach. This means that we use medications that work in different ways within your body to hit the pain from different angles. This helps get you the best possible pain control with the fewest possible side effects. Some of these medications will include non-opioid medications such as acetaminophen, which is the active ingredient in Tylenol. And even if you don't feel like it's helping your pain, it actually kind of works in the background in this instance to kind of hit that pain from another angle. Anti-inflammatories are another important class of pain medication. Inflammation is actually a key driver of pain after surgery, and the opioid medications, which we'll talk about next, don't actually target the inflammation process at all. They just kind of help your body not feel the pain as much. So the anti-inflammatories are very powerful at reducing your pain and complications after surgery. We may also give you a nerve pain type of pill that works directly on those nerve endings that are all jazzed up after getting your surgery. These multimodal pain medicines start even before your surgery happens. We will generally be giving you some of these medicines in pill form in pre-op prior to your surgery starting. And this kind of helps your body get a little less sensitized to the pain and helps us give you the best pain control throughout that acute surgical phase. Another important aspect of getting the best possible pain control is to discuss the anesthesia options with the anesthesiologist that will be visiting you in the pre-op area. Spinal anesthesia or the nerve blocks, or both of them, if you're a candidate, are excellent tools that we have to help give you the best pain control after surgery. The spinal anesthesia involves an injection kind of into the back, and it provides temporary numbing and pain control kind of from the waist down. And the nerve blocks are a type of injection around the hip or leg or thigh areas and kind of help provide temporary numbing from that point down. Both of these are incredibly safe, effective options for pain control that we encourage you to take advantage of if you're an appropriate candidate and they are discussed with you in pre-op. In addition to all of these non-opioid tools that we have, we will be using opioid pain medicines to help you manage your pain after surgery. These are the narcotic type of pain medicines, and they're the strongest pain medicines we have. They also have important risks and are incredibly regulated by the government, as you may be familiar. This means that we want you to take care to secure your prescription pain medicines after you leave the hospital. It's very important that any children, pets, visitors in the home do not have access to these medications. And there will also be instructions in your discharge paperwork for how to safely dispose of any unused pills that you don't use in recovering from your surgery at home. Another important aspect of staying safe with the opioid pain medicines at home is to make sure that there aren't multiple narcotics accidentally being taken at the same time. So if you have a prescription for something like a Percocet, Vicodin, oxycodone, things like that you were taking prior to your surgery, it's very important that you remove those from any pill boxes and safely secure those separately from the medicines that we will be prescribing you at the point of hospital discharge after your surgery. The medicine that we'll be prescribing you will be tailored just for you, just for recovering from your surgical pain at this instance. So it's not safe to mix that with any medicines that you may have in the home for other purposes that are also narcotics. And it's also important that they not be used for anybody else or any other point in your care. Now, if you have a chronic painful condition for which you are managed on long-acting opioid medicines such as OxyContin, methadone, buprenorphine, we will have a tailored plan to help manage your pain in a very patient-specific way throughout your surgical course, ideally working and coordinating care with your outpatient pain management prescriber. But generally speaking, it's not safe to mix these opioid pain medicines that we're prescribing you with other opioids or narcotics that you may have had prior to surgery. Additionally, because opioids have the rare serious side effect of slowing down your breathing or potentially even stopping your breathing if too much of these medicines build up in your body at once, the CDC now recommends that we send everybody home after surgery with Narcan to have in the home for safety just in case of emergencies. Narcan is the nasal spray that if, heaven forbid, somebody were to find you too asleep that they couldn't wake you up or having difficulty breathing after taking the pain medicine, they could spray this up your nose and call 911 for emergency assistance. Now, we absolutely do not expect that to be needed at all based on the medications and doses that we're prescribing you. However, because it is a rare, serious risk, it is recommended that all patients going home on opioids after surgery have Narcan in the home for safety, just in case of emergency. The opioid pain medicines are a temporary means of helping you control that moderate to severe pain immediately after your surgery. So we'll be using them immediately after surgery while you're in the hospital, and then prescribing a short course of them, generally speaking, at the point of hospital discharge. As you feel your pain start to subside, which generally will start after that kind of first 48 hours after surgery, that first couple days is where we expect the pain to get to a moderate to severe degree at times. After that point, each day from there on out should get a little bit better and better each day with the pain. So once you get to that point where your pain is starting to get less, that is when we want you to gradually take less and less of the opioid pain medicine accordingly, and just continue those non-opioid pain medicines to help control that more mild to moderate pain as the days go on from there. Most patients require the opioid type of medication for anywhere from 3 to 7 days after this type of surgery, but everybody's different. Just take it a day at a time. We'll be sure to be working with you and monitoring and optimizing your pain medicine regimen throughout your hospital stay, and we'll prescribe you the best pain regimen at hospital discharge as well. Another side effect that's way more common and mild for the opioids is constipation. Now, surgery and anesthesia significantly slow the bowels down to begin with, and the bowels are the last thing to wake back up after surgery. Additionally, every dose of the opioid pain medicine is constipating on top of that. So even if you don't normally have problems moving the bowels on a regular day, everybody has all of this working against them after surgery and needs help counteracting that to get things back to normal. For that reason, we have a few recommendations. First, making sure that you're drinking plenty of water throughout your perioperative stay. So the day prior to surgery, the morning of, and then after surgery in the hospital and at home. Maintaining adequate hydration is really important. You can also think about increasing your dietary fiber intake. So this means green leafy vegetables, whole grains, potentially fiber bars. Eating more of those foods in the days leading up to surgery has been shown to help your bowels recover sooner after surgery. In addition to this, everybody will get a gentle laxative stool softener type of medication starting the night of surgery and continued taken throughout the day until your bowels get back to normal. And that can take several days to a week for most patients. But it's something that we want to stay on top of so that it doesn't become a complication. We don't want anybody feeling like the gentleman in the top right of the screen, for example. So these medications will be given to you while you're in the hospital and then prescribed to you at hospital discharge. It is important to keep taking them every day as prescribed until your bowels get back to your normal and stay that way after surgery. Then you can just take them as needed from there on out. Additionally, it's very important to move early and often with physical therapy. Movement is really the best medicine. All of the medicines that I help the team optimize for you are really just there to help mitigate complications and give you the best possible pain control so that you can have a successful recovery after surgery. But moving early with physical therapy actually helps you get through the pain faster. It helps reduce your risk of blood clots, helps you get past the constipation faster, and overall is the ticket to your whole recovery. There are a couple additional aspects of your care that we want to introduce you to today that are important to help reducing your risk of having complications after surgery. One of these is blood sugar control. Whether you have diabetes or not, avoiding high blood sugar is very important around the time of your surgery to avoid the risk of having an infection develop at your surgical site. It is important to avoid sugary beverages such as Gatorade and pop, soda, and very sugary food around the time of your surgery, meaning kind of the day before, while you're in the hospital, and the several weeks once you're recovering from surgery. It's really important to maximize your nutrition during this time period, so thinking about foods with protein and fiber to help make sure that your body has the building blocks that it needs to heal your surgical site and avoid germs getting into that. Having high blood sugar significantly increases your risk for infection after surgery. If you do have diabetes, a lot of your medications that you normally take to control your blood sugar aren't going to be safe to take while you're in the hospital. So generally speaking, during hospital stay, it's very common that your healthcare team will be using insulin to control your blood sugar around the time of surgery. Insulin is generally going to be just a very short, temporary tool that we use to maintain your blood sugar in a very tight range to avoid this risk of surgical site infection. It doesn't mean that you'll be on insulin thereafter or at home by any means. It's just the best tool that we have to keep your blood sugar in a goal range without dropping you too low or getting you too high around the time of surgery. Additionally, smoking or chewing or consuming tobacco products is a major risk factor for developing a surgical site infection. We realize that quitting smoking entirely is incredibly difficult, and we're here to provide any assistance or prescriptions that will help you be successful in avoiding tobacco around the time of your surgery. This means not only while you're in the hospital, but for the weeks while you are recovering after your surgery. It's very important to avoid tobacco products because every puff on a cigarette or chew is decreasing the blood flow to that surgical site for about 10 minutes after each hit. So that means that during that time frame, with that decreased blood flow to your surgical site, germs are getting in and your body isn't healing the way that we need it to. So avoiding tobacco is of the utmost importance to avoiding surgical site infections, which can become very serious very quickly if tobacco is in the mix. There are a lot of options available to help you avoid smoking around the time of surgery, and my team will be glad to talk to you about these different options and provide whatever is going to be most helpful to you during your hospital stay and then prescribed when you go home to recover after surgery. One option for acquiring your prescription medications after surgery is our Meds to Beds pharmacy at Grant Medical Center. So this is a retail pharmacy housed within our hospital that is just there to provide prescription medications at the time of discharge from the hospital after your surgery. Using this service can be tremendously beneficial to our patients because you're going to be prescribed multiple very important medications when you leave. And being able to deliver these to your hospital bed so that you have them in hand before you go home saves you a trip from going to the pharmacy after you just had surgery and aren't going to be able to drive yourself or be very mobile. Additionally, because this pharmacy is in-house, we're able to work closely with them to troubleshoot any issues and also get you the best price or copays on these prescription medications. We also have access to manufacturer-provided coupons to make sure that we just make these medications as covered and affordable to you as possible. You do, of course, have the option for us to send your prescriptions to your home pharmacy. That's completely your choice. This is just a great option for our patients because we can really work through any issues that arise, get you the best price, and then send you home with these in hand. If our Meds to Beds pharmacy is something that you would like to use, make sure that you endorse that to your nurse when asked if you want the Meds to Beds pharmacy for your prescriptions that you'll be sent home on after your surgery. Keep in mind that because these are prescription medications to be taken at home, you may still have copays that will need paid at the time of dispensing these medications to you at hospital discharge. So it's important to just have your insurance card and some means of covering that either with you or with a family member so that we can send these home with you successfully. We don't always have a way of knowing exactly how much things are going to cost prior to your surgery, just due to the complexities of insurance coverage and where you are in your plan. But you will be called in your hospital room with exactly what that lowest copay we were able to process everything came out to, so you know exactly what it is before we deliver them and collect payment for those. Another tool that we like to make our patients aware of to help with prescription costs is GoodRx. This is a website that can potentially help decrease prescription costs even further. We do automatically do these types of things for our Meds to Beds pharmacy, but if you are using your home retail pharmacy, such as a Kroger or CVS, sometimes you can look at goodrx.com or look at the app. All you have to do is type in the medication and your area, and they'll help you price check and find the cheapest available cost for your prescription medications within your area and across all pharmacies. As I said, movement is the best medicine though. All of the medications we just talked about are there to help avoid complications and help you get the best possible pain control after your surgery. Next up, you'll hear from my colleagues in physical and occupational therapy so that you can know what to expect when working with them after your surgery.
Hi, my name is Sage. I am an occupational therapist who works at Grant, and we are going to be talking about what your expectations should be from physical and occupational therapy after your joint replacement. So the therapy team will work with the nursing staff just to get you up and moving after your joint replacement. So we work together on some goals. We work to help you get in and out of bed, up and down from a chair, teaching you how to walk safely with a device. We typically start our patients out with what's called a wheeled walker, and it's silver with 2 wheels on the front. It's just the safest mobility device to start you with. So we'll teach you how to use that. And for those of you getting a hip replacement, we will teach you how to maintain your joint precautions. Physical therapy, they will work with you to practice going up and down stairs if you have stairs in your home. For those of you getting a knee replacement, they'll work on improving your range of motion and strength through an exercise program that we'll talk about in a little bit, and just work to progress your mobility so that you can feel safe going home. And then for occupational therapy, we will help work on making sure that you can use the bathroom independently, dress yourself, bathe yourself, and just making sure that you feel safe and ready to return to independence with your daily activities. So being dressed for success. Sam talked a little bit earlier about what to wear to your surgery. For those of you spending the night, make sure that you're packing loose and comfortable shorts and shirts to wear during your hospital stay, and just making sure that you have loose, comfortable clothes to wear at home as well. If you are staying the night, occupational therapy will work with you, teaching you how to use adaptive equipment or maybe different techniques to help you get dressed. And we'll help you to get dressed in your own clothes too. So it's important that you pack something that you can practice with in the hospital. So first we'll be talking about those of you getting a hip replacement. Most of you will have what's called posterior hip precautions. Precautions is just a fancy word for motions that you want to avoid while you're still recovering, just to help protect your joint and make sure that it's healing effectively. So there are 3 major motions that you want to avoid doing. The first is not bending over 90 degrees. Examples of this would be if you're sitting up in a chair, you don't want to bend over to get down to your feet or to pick up something off the ground. You also want to avoid sitting on low surfaces like a low toilet or a low couch. You also want to avoid twisting or rotating, especially internal rotation, which is where your foot or your toes come in towards the center. What this could look like is if you're up and walking with your walker, you don't want to do big twisting motions, you want to do little turns. And also not crossing your legs. This goes for at the knees or at the ankles. I always tell people if you are a leg crosser, now's the time to start practicing not doing that, and it can be a hard habit to break. And then you don't want to sleep on your side until you have your doctor's approval. The reason for this is getting on and off of your side, and while you're in a side lying position, you're probably breaking most of these 3 precautions. So you just want to be extra careful. And again, if you are used to sleeping on your side, maybe practice at home with pillow arrangements to see how you're going to be most comfortable sleeping on your back. So there are some equipment options that we just like to educate you on as far as what can help you still be successful and independent doing those daily functions just by using a little bit of equipment to help. So as I said before, your hip precautions can prevent you from bending down to your feet to put socks and shoes, pants and underwear on. So in the middle there we have what's called an adaptive equipment kit or a hip kit. This includes equipment such as a reacher, a sock aid, an extended sponge, and a shoehorn. These things can be really effective in helping you to still maintain your independence while helping you get dressed. And these are things that we'll practice with you in the hospital with occupational therapy so that you feel confident using them at home. Other things that can be very helpful or essential for you to be safe at home would be a shower chair or an extended toilet seat. A shower chair that you see on the left of this slide and the extended toilet seat you see the third picture over from the left. Both of these items, they're typically not covered by insurance, so we advise you to look into getting these pieces of equipment ahead of time, whether that's purchasing them yourself, borrowing from a friend or family member, or looking into community resources to see what's available. It can just make it a lot easier if you get these pieces of equipment before surgery, so that way you don't have to send a family member searching after your surgery when you really need it. It's also important to think about comfortable seating options at home. This can be something that's overlooked by patients pretty often. Low couches or deep seating recliners can be very difficult to get up and down from, and can also be breaking your hip precautions to use. So having a comfortable chair, especially one with armrests that you can push up from, something that's high enough where you're not going to be breaking that 90-degree rule, can be really helpful in making sure that you're feeling comfortable and safe at home. So we'll switch gears here to the total knee replacements. For those of you getting a knee replacement, we start everyone out with a goal of 0 to 90 degrees as far as the range of motion that we would like to see. Now, this can be different based on each person. 0 degrees would be your knee completely straight, up to 90 degrees, which is a right angle that you see on the bottom left photo there. So physical therapy will see you the day of your surgery, even just a couple hours after you wake up from surgery. They're going to come in to see you to get you moving and to get you mobilizing as well. They'll bring in a tool with them called a goniometer. That's that tool that you see in the 2 pictures on the left. What this does is just measures the range of motion of the knee. So we want that knee moving right away. As your soft tissue was stretched and moved during surgery, we want to make sure that we are moving the knee and that you're preserving the range of motion. So that way, as you're healing, you're going to have a functional knee. So MedBridge is the platform that we are currently using to build our exercise programs. MedBridge is a platform that allows us multiple ways for you to access your exercise program. Whether you are getting your hip replaced or a knee replacement, you will be getting an exercise program. For those of you getting a hip replacement, we like to call your exercise program a warm-up to walking, as we prioritize your walking program. And those of you getting a knee replacement, this can really help assist you with preserving that range of motion as well as building up your strength during your recovery. So we will give you a printout of your exercises while you are here at Grant, but you also have the opportunity to access these through videos. So you will be getting a QR code in your discharge paperwork that you can scan to have a mobile phone view. So here's what the mobile phone view looks like. You have not only the description of your exercises, but also video recordings to watch as well. If you don't feel comfortable using a QR code, we also have the option to send you a link to access your video recordings through text messages or through email. Your physical therapist can always help you set this up on your phone if you're interested in accessing the program this way. Next, we'll have Jacqueline come to wrap up the total joint class today.
Thanks, Sage. My name's Jacqueline. I'm the educator here at the Bone and Joint Center for Surgical Services, so we'll finish up here today. So discharge planning. If you do end up staying the night, typically that is just an overnight observation. Ultimately, our goal is for you to go home. Typically, patients are more comfortable at home, less likely to get an infection, but we do recommend that you have a friend or family member available to you those first 24 hours to 72 hours after surgery. You're still going to be getting used to that brand new joint, so you might want some helpful hands there following. Preparing your home before surgery will help increase your safety and independence after surgery. You're going to want to start to move any items that you would need to get on a step stool or chair, bring those down to the counters, or bring up any sort of items that you would have to bend down and reach into a cabinet. We wouldn't want you breaking any of your hip precautions, nor would we want you falling on that brand new knee or hip. Start to remove anything that you could trip over. Think throw rugs and in long extension cords. So throw rugs that might be in front of your kitchen sink or in the bathroom that could get caught up in your walker. Any long cords like iPhone cords or phone cords, any sort of standing lamp cords. We wouldn't want you to trip on those things. You might want a nightlight for the trip from your bedroom to the bathroom at night. And as much as we love them and they can help us heal, our pets can be tripping hazards. So maybe having a baby gate to keep them in a different room while you're up walking around doing your exercises. Maybe have a friend or family member watch them for those first couple days after surgery. I'm sure you're not going to want to take that pet on a walk those first couple days. Also, just be careful. Pets like to jump, and they're not going to know that you just had your knee done. It's always great to do any cleaning, errands, laundry that you can do ahead of time. Preparing meals ahead of time will make your life a lot easy. So after surgery, you can just pop that in the microwave. So start downloading those food apps, those DoorDashes, or setting up any sort of meal delivery will definitely make your life easier following surgery. After surgery, you will need a ride home from the hospital and a friend or family member to drive you to any of your follow-up appointments. Depending on your surgeon's preference, the surgery you had done and what side you had it done on will determine when you'll be able to drive again. Typically, it's anywhere from 2 to 6 weeks. We like to tell you that in advance so you can start planning some of those rides. If you choose not to use the med-to-bed option, you will need someone to drive you to the pharmacy on the way home from the hospital so that you can pick up your antibiotics and your pain meds and your blood thinners. After surgery therapy. After a total knee replacement, it is very important that we continue your physical therapy. After surgery, you can go straight to outpatient therapy, or you can do 2 weeks of home health physical therapy. This will be determined in office with your surgeon. If you do discharge the same day, the office will have already set this up for you, but if you stay overnight, our case managers will arrange this therapy for you. For our total hip replacements, home health will come see you to come check in on your gait training and come check in on your dressing and see how that's doing. That'll be just a couple of visits just to make sure that everything's going well. Again, if you discharge home same day, the office will already set that up, and if you stay overnight, our case management will start that. After surgery, all patients will need a front-wheeled walker. We do ask that you avoid a rollator. This is not something that you need to bring into the hospital with you. We do have some of those that you will be able to use in the hospital. We do just ask that you leave it in the trunk of your car. You will want that for the walk from your car inside your house. Sage already did talk a little bit about the elevated toilet seat and shower chair. I just want to briefly go over some of the places that you can get these things. So since most insurances will not cover these, we ask that you grab these things ahead of time. You can get some of these things at Amazon, CVS, Walgreens, Walmart. Resale stores have a ton of these things. Ask around to family and friends. You'd be surprised how many friends and family have these things hidden away in attics and basements. There are also many churches that have programs that will give out equipment that you can call and borrow. We have one listed here, Peace United Helping Hand. So ask around, look online. There's plenty of places that you can get this equipment. After surgery, it's important that you take your pain medication prior to your sessions with physical therapy. I typically tell patients to take that pain medication about 30 minutes to an hour prior to your physical therapy session so that you can really maximize that time with them and that pain won't be holding you back at all. We're going to ask you to eat nutritious meals to help you heal. I always say focus in on protein. You'll want to make sure that you take your pain medications that you are prescribed by your surgeons. Most importantly, make sure you're taking those blood thinners and those antibiotics. All of the other medications will be at your discretion. So if you feel like you need your pain medication or if you need your stool softener, that'll be up to you. Make sure you look at your discharge instructions. They have great instructions on how to take any of those medications. We're going to ask you to take an antibiotic prior to some procedures post-operatively. This will be a new lifelong precaution for you. So make sure that you call your surgeon prior to any future dental procedures. They are going to prescribe you an antibiotic. Typically, this is a 1-day, 1-dose antibiotic to help prevent an infection. The idea behind this is that we have a lot of bacteria in our mouth, and then there's always the potential that that bacteria is broken loose during an appointment, which goes to your bloodstream and could go to your brand new hip, knee, or shoulder. So this is a new lifelong precaution. Your surgeon will discuss this more at your follow-up visit. Incision care, once your dressing comes off, you will be able to shower. We're going to ask you to just very gently wash over that incision with just a little bit of soap and water. It's very important that you're not scrubbing hard at that area. Just be very gentle. And always start at your incision site and clean outward. We don't want to clean other parts of our body and then go to our incision. And then getting out of the shower too, make sure you're using a clean towel. Dry that area off, just blot that area first and then dry off the rest of your body. We are going to ask that you avoid putting any lotions, powders, creams in that area. So no body lotion, no vitamin E oil, no Neosporin. We don't like anything that in the area. We just like your incision nice, clean, and dry. And then no hot tubs, bathtubs, swimming pools, anything like that till you're completely healed and your doctor gives his approval. Managing swelling at home. It is common to have some swelling and bruising around your brand new joint. There's a couple things that we can do to help prevent this and decrease that swelling. First and foremost, elevate those legs. Try and get them to the level of your heart to help with that swelling. Wear your compression stockings that you'll go home with. You can put those on right when you wake up in the beginning of the morning and take them off at night. I always say just try and put them on first thing in the morning before your legs start swelling. We will give you a spare pair to go home with so you can wash them in the sink and hang them to dry so you can have 2 pairs. And then you're going to want to ice frequently. We love ice here at the Bone and Joint Center. We do say avoid heat. Heat can cause that swelling, and that swelling will cause you some pain. So go with ice. 20 minutes on, 20 minutes off. But really, you can't ice too much. And go ahead and get anything that you're going to use to ice with. You can do ice in a bag, you can do peas, you can do gel pads, whatever you want to use. I do recommend whatever you choose to use to have 2 of them so that one can be in the freezer getting cold and one can be on your knee or hip. Now there is an appropriate way to elevate your legs after a total knee replacement. So we want to make sure while you're elevating your leg that it is nice and straight. After surgery, you're building up scar tissue in that incision site. If you rest with a bend in your knee, you're going to build scar tissue with a bend in a knee, and you'll lose some of that range of movement that your surgeon just got for you. So make sure when you're elevating that your leg is completely supported and nice and straight. So either elevate it all the way up so it's nice and straight, or put your pillows and blankets under your ankle because that'll force your leg to be straight. We are going to ask that you do not rest with a pillow or a blanket just underneath that knee like you might be doing prior to surgery to help with some of that pain. Activity after surgery. We're going to have you walk each day, gradually increasing your distance. Physical therapy will help you make those transitions from a walker to a cane to walking independently. We ask you not to drive, play sports, or use any sort of exercise equipment. And it's okay to resume sexual activity when approved by your doctor. You can talk about this at your follow-up visit. Reasons to call your surgeon if you notice any sort of signs of infection. So that would be any severe swelling, redness, drainage. It is normal to have a little bit of drainage from your incision, but if you're saturating multiple dressings, we become concerned. So make sure you're calling your surgeon. Other signs of infection, temperatures. If once your dressings come off, if you start to see the edges of your incision start to separate, those could be signs of infection, and make sure you call your surgeon. Call if your pain gets worse and isn't controlled by your pain medication. Or most importantly, if you are experiencing any sort of signs and symptoms of a blood clot like we talked about earlier. This is why it's so important to take your blood thinners. Signs of an antibiotic, typically redness, warmth, pain, swelling. Those like to travel to the back of our legs, so your back of your legs could be really painful. Or if you start having any chest pain or shortness of breath, call the EMS right away. If you have any concerns, make sure you call your surgeon first and try and call during business hours. A lot of the times, if you call during the business hours, your surgeon can get you in to see you that day or even the next morning. If you have any questions or concerns, remember you have that total joint replacement guidebook that has all of this information and more. You will be discharged home with a big packet of instructions that your nurse will go over with you and your support person. And always call the surgeon's office if you are concerned or have any follow-up questions. That is it for us today. Thank you so much for listening to all of our great speakers, and good luck on your total joint replacement surgery.